Okay, I think we'll get started. This section is called Disability in Medicine, and I'm Dr. Robin Timm. And today, I hope there's at least two things you can take from my lecture. I'm a neuropsychologist, so I thought I would talk briefly about neuropsychology, give a shout out to my occupation, and tell you what I do, and then also talk about disability and going into the medical field and healthcare. And so some of these topics we're going to be covering. And if you want a handout, a PDF form, you're welcome to leave your email on this sign-up sheet, and then one of the proctors will be sending you the PDF form.
Thank you.
Okay. So I'm a neuropsychologist. Have many people are familiar with neuropsychologists? No. Okay, good. I'm glad there's some that are not. I work at UC Davis Medical Center, and I'm with the Department of Physical Medicine and Rehab, and I'm also with the Spine Center, and I'll explain what I do there. I'm also a clinical supervisor, so I supervise graduate students when they're in postgraduate training. I teach a didactic to our students as well once a month. And then in my other part of my life, I'm also a neuropsychologist in Berkeley at Sutter Alta Bates. It's a rehabilitation hospital, and I work there part-time. And if my schedule wasn't so busy, I'm going to make it busier by telling you that I have my own business. I have my own private practice in Napa, and I do clinical neuropsychological assessments. I'm an expert witness for traumatic brain injury, so I do depositions and trials and testify on traumatic brain injury. And then I do consultation. So I'm a consultant for a couple of agencies in Sacramento. One is called Eschaton. It's an adult day healthcare center. And then Easter Seals, they have a head trauma treatment program. So I go out there several times a month and consult with the staff. So, and also I volunteer. I do volunteer work in the community. So you can see that when you go into healthcare or you go into psychology in particular, you can be pretty busy. So a lot of times people worry about, am I going to get a job, and am I going to get employed? And then if I have a disability, will that make it even more difficult? Well, if anything, I'm probably overemployed. And in my volunteer life, I'm the chair of the Napa County Board of Mental Health. So I advocate for mental health services. I get to know all the different services in our community. And I interact with county professionals and other people in the area. So a neuropsychologist basically is a licensed psychologist, but we specialize. We don't deal with the psychoanalysis of what happened when you were growing up and are you anal and all of that Freudian issue. We deal with your brain. You know, how's your brain and how your neurological functions functioning, and how does it affect your emotions and your physical well-being? So as a neuropsychologist, I spent a number of extra years of training, taking neuroscience classes, neuroanatomy, physiological psychology, neuropsychological disorders, neuropsychological assessment. Neuropsychologists are unique because we get a lot of referrals from people that want to know what's going on. Do I have dementia? Do I have learning problems? What's going on with me? And we do diagnostic testing and assessments and try to figure out what's going on. What's the most likely explanation for the problems you're presenting with? In my life, I do pediatric and adult neuropsychological assessment. I do individual psychotherapy with adults, and mainly these are going to be adults who have both physical problems as well as psychological problems. And then I also do, I have a unique niche in that I work with our neurosurgeons and our orthopedic surgeons, and I do pre-surgical neuropsychological assessments. So we get individuals who are up for elective spine surgery and may be at high risk for a failed back surgery, and the surgeon has some concerns. I want to know more about this person, and they send them to see me, and I spend about 4 hours with them doing an assessment, doing some testing, interviewing, and figuring out what are the risk factors and what can this person do to increase the likelihood they're going to have a better outcome. So I do all of those things. So psychology can be a real, there can be a lot of variety in what you do. You could be working in medical centers, outpatient clinics, nonprofit organizations you probably won't make a lot of money at, private practice. You can have your own business as a licensed psychologist. Universities have neuropsychologists, and also research. So I've worked in all of these areas as well. So we work with individuals with traumatic brain injury, stroke, learning disabilities, ADHD, brain tumors, people who have had chemotherapy, post-chemotherapy, Parkinson's disease. We do dementia evaluations. And some of us kind of specialize in certain areas. My area that I love is traumatic brain injury. So, I was trying to come up with some information about doctors with disabilities, and it's kind of difficult. There's not a whole bunch of information out there. There's not a whole bunch of us out there, in fact. And so a lot of the medical journals and websites and things you look at, most of the images don't show a person with a disability. And we're underrepresented in the medical field, so we're kind of rarities. Hopefully that'll change. And it's pretty unusual to see a doctor. So when I go out to see my patients, they're kind of shocked to think I'm their doctor. I'm in a wheelchair, and I'm going to provide them with some kind of treatment or service. That dissipates pretty quickly once they get to know me and once we start doing work together. I think the disability becomes quite secondary. But most of the time when you're working with doctors and medical students, that's not something that they easily talk about is, what's my disability? If it's a hidden disability, certainly mine is not, but other people have hidden disabilities. And I think that might be because people don't want to be judged by their disability. They also may have some shame because oftentimes our society puts some stigma around great stigma around disability. So what's a disability? Probably, if you're here, you probably know what it is. But according to the American with Disabilities Act, it's a physical or mental impairment that substantially limits one or more major life activities. And there's a record of such impairment, and you're regarded as having that condition. And then even though you're a student with a disability and you meet that definition I just showed you for having a physical or mental impairment, it doesn't really qualify unless it substantially limits a major life activity. So that's pretty interesting because that's something to pay attention to. Major life activities are caring for yourself, performing manual tasks, walking, seeing, hearing, speaking, breathing, learning. Learning could be a hidden disability, and working. So I was trying to find out how many people go into the actual medical field, and I uncovered some pretty disconcerting facts about the medical profession and applicants with disabilities. So on paper, medical schools, admission practices and procedures, they have to comply with federal regulations under the 504 and ADA tenets. These regulations prohibit an institution from following certain practices, and here's some of the examples. Denying admission or discriminating against a qualified person on the basis of their disability, applying limitations to the number of persons with disabilities that may be admitted. So they can't say I'm only going to take 3 to 10 people who have disabilities. They can't put limitations on that. They can't use any test or criteria for admission that has a disproportionate adverse effect on people with disabilities. And it can't make pre-admission inquiry as to whether you have a disability or not, like what's going on with you, what's wrong. And I'll tell you a little, as we go along, a little bit about my experiences having gone back to graduate school to get my doctorate. Even though I'm employed, did I encounter discrimination? Yes, I did. Did I encounter it at the graduate level applying for programs? Yes, I did. I encountered it all the way through. So it's not always an easy process. There we go. So ADA reasonable accommodation, this is kind of important to pay attention to also if you're going into the medical field. Schools are not required to waive or eliminate elements or goals or the purpose of the program, and schools are not required to create a new program, especially for students with disabilities, or offer different or lesser benefits, and they're not required to make reasonable accommodations where doing so would create a, quote, direct health or safety risk to the student or to others. So that kind of interested me when I was reading that, and I was wondering what that would mean to be causing direct health and safety risks to students and others. So both the ADA, they provide that a person with a disability is not qualified for post-secondary education if his or her participation would pose a direct threat to the health and safety of other individuals. So looking that up, they meant the direct threat means a significant risk that cannot be eliminated by modification of policies, procedures, or practices, or by provision of auxiliary aids or services. So here's a scenario. Here's the catch-22. Example number 1. So you have a verifiable disability. Let's say you have quadriplegia. that substantially limits one or more life activities, use of your hands. And while you are eligible for reasonable accommodations in the academic environment, medical schools may refuse your application because they decide you cannot perform the technical requirements of medical school and that you pose a direct threat and safety to patients. So medical schools are at the mercy. A lot of these regulations fall under the United States Medical Licensing Exam, which outlines the technical standards. That is, once you go through medical school, then you're going to get licensed, that are part of the package allowing certification of schools' ability to give students access to licensing examinations. So medical schools hold students to both technical and academic standards. So you could have a 4.0, you can have great academic background, but then the other piece, especially to medical care and medical schools, is the technical piece. So while medical schools may deny admittance to applicants with visible disabilities, because that's maybe something on the outside that they can see and question, there are no restrictions for applicants with hidden disabilities. So if you have a disability, it's hidden, like a learning disability, ADHD, brain injuries can be hidden, a psychiatric disorder, those are considered hidden. So here's the other part. Example number 2. So you have a verifiable hidden disability, a learning disability, but it does not substantially limit any life activities. So you can care for yourself, you can use your hands, your legs, you walk, you're fine. You could be denied reasonable accommodations. And while you may be accepted into medical school based on your ability to show that you can meet outlined technical and academic standards, you may struggle more and even fail if you don't have those accommodations. Because as you know, if you have a learning disability, having certain accommodations can be very helpful in the learning process. So I was trying to figure out how many people out there are physicians with disabilities. They're very scarce, the statistics. So I found that about 0.2% of medical school graduates have disabilities, but that data came from 1996.
And that's people who are aware that they have a disability and identify that way.
Yes.
Okay.
And a 2002 study done at UC Davis Medical Center by Dr. Takagawa, I can't say his name, looked at emergency medicine residency programs and found that 1.3% of residents had a known diagnosed disability. And 61% were diagnosed while they're in residency, before residency, 35% were diagnosed during their residency, and then 6% that was kind of unknown. And here's a breakdown of the disability types that they found in the emergency medical residents. So a large percentage of them, 29%, had learning disabilities. Almost 13% had depression or bipolar. Again, these are very hidden disabilities. A 9.7% musculoskeletal, and then it goes on.
Is that of the smaller percent?
Of the 1.3%.
Yeah. Okay.
Mm-hmm. So I think one thing, going into graduate school or medical school, people with disabilities almost feel like they have to overprove themselves. They have to show that, you know, I have more skills than you, I have more degrees than you, I want you to pay attention to all my abilities as opposed to my disability. It's almost like you have to have a lot more ability than the average person. So we have this kind of term in the disability community called being a super crip, being extra special, getting all those extra skills, being perfect at what you do. Being there every single day on time, doing everything you can so that people can pay attention to who you are and your abilities. Because initially when people see a visible disability, that's the first thing they see as opposed to seeing who you are and the qualifications that you bring. So we're all kind of guilty of this. And if you're in UC Davis or in graduate school somewhere else or in school period, you probably have some of these qualities that are preparing you anyway for work in the medical field. So individuals, I think, who go into this field who have a disability, there are some obstacles. So as I was telling you, when I applied for graduate school, I encountered some of those obstacles and I was quite shocked because I'd been working for many, many years with people who have disabilities and I thought, you know, this isn't going to apply to me. But unfortunately it did. And when I applied for residencies, for training, I was told I wasn't getting a position because I had a wheelchair. And that if I was working with children, I couldn't crawl around on the floor. which isn't true. I can crawl around on the floor. It's not pretty getting down, it's not pretty getting up, but I can do it. And some people would not even interview me if they knew I had a disability. And so it was a real challenge, and I ended up going out and finding and developing my own residencies. And I ended up working at UCSF and San Francisco VA doing research and also clinical work. So I had to go out and find mentors. I had to go out and find people that really believed in me and find places that I wanted to work at. I was told by the graduate school, oh, just take anything you can get. Just go there to that psychoanalytic institute. And I'm not even a psychoanalysis person. So I had to go out and really develop what I wanted and go for it. So it took a little extra effort, maybe an extra year of my time as well in graduate school, but it was worth it. I was doing exactly what I wanted to be doing and working with people that really saw who I was, saw my abilities, and gave me a lot of opportunities. So finding mentors, I think, are really, really important. Finding people that can help you through that process, and networks as well. And nowadays, networks are quite available on the computer. There's lots of networks where people can connect with each other and share information, and that's really valuable. In the past, that really didn't exist in my era, so you had to really physically go out and find people. So that, I think, is a great advantage for students nowadays, that you can connect with other people. And I think that there's some idea when people apply for graduate school or placements that there's going to be a problem, that, you're going to be a problem. You're going to be demanding a bunch of things. You're going to be holding us back. You're going to be costing us money. And that's really not the case. I work in hospitals, I work in clinics, and the biggest thing I have to do is move things. So I figure, that's the least of it. That's really all I ever ask for, is being able to have access to my patients. So some ideas, what I think that medical schools and training programs can do. Disability awareness is not a required subject in many graduate programs. In psychology, it's not required. They talk about ethnicity and other type of cultural sensitivities, but disability is not required. And it really is the largest minority out there of individuals. So more disability awareness training, helping people to become more aware of our differences and how we can work with them, how professional colleagues can work with you as well. Again, I was very lucky, I think, because I made contacts. So networking with people and getting out there, you have to put that extra effort in no matter what, is making those kind of connections with people. Facilities and databases, and need to offer medical personnel mentoring programs. So it would be great if, certain psychological associations, you can be mentored by another person with a disability. In neuropsychology, you can be mentored by another neuropsychologist. And that's great to have those kinds of people who have been down that road before and know all the obstacles and can give you some support. And then employers still need to provide some equipment and accommodations. But usually when you're going into, if you're going into psychology or neuropsychology, it's not that much, except that with neuropsychology, if we do a lot of testing, so obviously I'm manipulating a lot of things using my hands, and that's part of the training in psychology as well, is that's your special niche that other clinicians don't do, is testing. And then I think being familiar as applicants, if you have a disability, being familiar with what goes on out there. As much as we often say, there's laws that protect us, there's ADA, people still are violating every possible law out there. They discriminate. They take every opportunity possible to exclude people with disabilities. So being aware of your rights and being aware of all the possibilities that exist, because I don't want to paint it as a rosy experience, even though I'm overly employed. It was not easy. But I would not be doing anything else. If you feel like this is the only niche for you, is medicine, working in the healthcare field at some capacity, being a neuropsychologist, then you'll go for that. You'll do it. You'll know that, okay, there's going to be obstacles no matter what. But it is a long road, and it takes a lot of dedication. So I'm giving you some resources here, and then I'm going to open it up for questions, because you can ask me any questions except my age and my weight. So these are some resources I found. They have medical students with disabilities. This is from the Association of American Medical Colleges, and you can get this online free in a PDF form. I always like free things, so that's great. Then medical students with disabilities. That's another book that's out there by Jennifer Watson and Shannon Hutchins, and that talks about the obstacles and challenges and things to be aware of. And there's some good websites too that Society of Physicians with Disabilities. So if you're you want to go to medical school, there's some connections out there for you. Society of Healthcare Professions and Professionals with Disabilities. And they have articles and they keep people up to date on what's going out there with different lawsuits or different medical schools, which is very interesting. And then some useful neuropsychological resources, if you're interested in my field, which I hope you are, is the Society for Clinical Neuropsychology. Gives you some great definitions and guidelines about neuropsychology. I'm a professional member of the National Academy of Neuropsychology, and they have lots of great information. They have conventions every year and research opportunities. And then INS, the International Neuropsychological Society. And again, all of these take student memberships, people that are undergraduates or in graduate school. So I wanted to leave enough time, because last year people had a lot of questions, and I didn't leave enough time for that. And I wanted to be able to answer questions if you have them. Yes?
I was wondering, from your experience, I like to reveal my hidden disability when I'm especially trying to work in the healthcare field, but I'm just wondering whether or not I'm challenging myself, or like you said, trying to be a super crip, trying to show to people that I have this, yet I can do this. Or is it something that to really expose people to because it's more of a personal thing?
During the interview process?
Interview process and just going through school.
Mm-hmm. Well, first of all, it's against the law for anyone to ask you in interviews whether you're applying for jobs or whether you're applying for graduate school or practicums or internships to ask you if you have a disability. Do they do that when you're applying for internships? Yeah, they do sometimes, but you're not obliged to answer that.
Right.
It's illegal. So, is that something you have to tell them about during the interview? No, it's not. I interview applicants every year, and I'm more interested in hearing what they're bringing to the site. What kind of skills and experience do they have? What kind of passion do they have? What do they want to learn? I want them to sell me on themselves and what they can do. So I would focus on that.
Right. That makes sense.
If you felt like you needed a certain accommodation at some point, I would wait till you have an offer on the table and you're sure that that's where you want to work, or that's where you want to do your residency or internship, and then say, this is what works best for me.
I just find it just feels a little bit like sacrificing your integrity to have to hide it, until it actually comes out. But I guess there's no reason to broadcast it, right?
No, we're not, like at UC Davis Med Center, we're not taking graduate students. We're not saying we want graduate students with disabilities. We want graduate students that are well prepared. Some of those people have disabilities and we don't know about it, and we're not required to know about it. And I want to know, have you done testing before? Is testing the thing you love to do? Do you love neuropsychology? Do you want to learn cognitive behavioral therapy? I don't do the Rorschach, I don't do this, I don't do that. So I want to find out if people have those basic skills. And also if they're going to be on time, if they're going to be there every day. We have patients every day, and their work habits. So I think skills and what you bring to the table is really the important thing in any kind of job interview or interview for an internship that you need to focus on. And I don't think it's being dishonest.
Okay.
They're not entitled to that information during the interview.
Great, thank you.
So, yes.
So I'm noticing, relatively really early on in my school path, for example, this past semester our school cut all funding for faculty math tutoring. So in situations like that, I know there is a separate workshop that's about financial resources, but I was more wondering if there are some general directions or ideas for when we hit roadblocks and need to come up with okay, well, kind of like you were saying, I can think for myself, let me find these resources and pull them together and cobble something together that's going to work okay. but a lot of times it costs, obviously, money. In general, are there like types of resources we might be missing that we could be connecting with earlier in our school experience?
Well, I would like to say the state of California Department of Rehab does stuff, but they do nothing. They really don't, unless you have a real severe disability. If you have a learning disability or something that's pretty hidden, then you're not severe enough to receive services. And they really discourage people with disabilities from going on to higher education, when actually that's what people with disabilities need. You know, your cost of living later on in life may be more. You need money. You need something that's going to support you better than a job where you're making $10 an hour. So I would like to say them, but I'm going to discourage you completely from thinking that that's a great resource. And you do have to fight tooth and nail if you become a Department of Rehab client. And I'm going to tell you, I'm going to reveal something to you. I worked for that department for 15 years. So I was one of those rehab counselors. And I decided it was really going against the grain of what I want to do and working with people with disabilities, and left. So I do know the workings, and I think I'm a credible reporter on this. But another idea might be bargaining, or bargaining with people, saying, I can do this for you if you can help me with tutoring. Okay. Money isn't always the thing you can bargain with. You can say, I can clean your house for a couple of hours, walk the dog, do these things. So being creative in that way, where you have something to give somebody else in return. But in terms of financial resources, it's pretty slim. Unless you can talk the Department of Rehab into providing those services and paying for them.
So the Department of Rehab will provide support for medical school? Will they do that?
They're going to say no. They're going to say no.
Yeah, they have already actually said no.
Yeah, right. And I think the way to approach the Department of Rehabilitation is showing that the dollars and cents. For example, they don't like buying people vans. That's a big, no, I'm not going to get you a van, forget it, you don't get it. But they're willing to pay for transportation, into the thousands and thousands of dollars per month. And if you can justify that, you invest this money and there's going to be a good outcome. So you invest this money and help me go to graduate school or medical school, or even a portion of it, then there's going to be a good outcome, and I'm going to be employed, and I'm not going to have to need all these other services here. So, money speaks. I think money talks in our society, and it talks with them as well. So if you try that approach, is, laying it out for them and them seeing it as a good investment.
Oh, thank you.
I remember you from last year.
Yeah. Same. I remember you also.
Other questions?
I have a question here. For an internship, what tips do you have that I would be able to, since I'm deaf? What kind of internship would I be able to get? I don't want to take up a lot of time. They think that I will because I'm deaf, and I'd still like to do that, but do you have any suggestions?
What kind of internship do you want?
Medical.
Mm-hmm. Can you be more specific? Things you're interested in?
I guess I don't know specifically yet. Something working in the hospital, clinic.
And so tips on what might work best to getting an internship. I think, again, selling your skills and abilities. And also, if you're considered to be bilingual, because you have another language, and that's a big selling point. But selling your skills and abilities as well, what it is you want to learn and what it is you bring to the table. That's probably a simplistic answer, but you're welcome. Question.
Would using your disability as like justification for your passion for medicine, is that okay, or would that just be like, or would I have to like say bring more stuff to the table besides that?
I think that's a in addition to type of situation. I think you might get asked to write something, you know, how did you initially get interested in medicine or this area of healthcare? And it might be because you have somebody in your family had a certain condition or you had something going on. But I still think that's not enough. I still think you need to have the skills and experiences and show that you're making that dedication to your field as well. But I do think it adds a certain dimension that other people don't have, you know, that you have that insider's perspective. And I think that that's a plus, is working with people in healthcare, you have more, if you have a disability, you might have a little bit more empathy and understanding, and understand what they're going through when they're having to go to the doctor a lot, or they're having to reveal information to various different doctors at different levels. So having that insider's information about disability can be really helpful. You know, I had a patient once that came in and she was very, very upset because she had to go get a new brace for her leg. And she said, all I really want to do is go out and go on a date and go dancing, but now I have to wear a tennis shoe with the brace. And I could really relate to that, because I thought, gosh, I love shoes. Who doesn't love pretty shoes? Well, maybe you don't. But who doesn't love pretty shoes? And so I could really understand what she was going through. So I went with her, and it's all in the same building. So I went with her to our brace maker, and I said, you know, you're going to have to work with this lady. She really doesn't want to wear big, clunky tennis shoes on a date. You know, help her so it's fitting well enough so she can wear some different shoes. And again, that wasn't any kind of insight he had, but I was able to help him because this is something that was really important to her. And a lot of times, you know, equipment and all the things you use in disability are not really, you know, fashion conscious or attractive. So having that insider's information, I think, in that experience and what's driven you to the field is really important. It adds a different dimension to your application. You had a question?
I'm still forming it, thank you.
Okay.
I have another question. Oh, do you have someone else?
Oh, you're okay.
So you mentioned that during the middle school medical interview, that we do not have to tell them we have a disability, right? But if you're deaf and we need an interpreter in the room, it's already obvious. So do you recommend a different approach because of that situation, you know, so that we can talk, you know, with the interviewer? And that we would have the same kind of medical education, the same as our hearing peers? And also the access to communication. We want to show the interviewer that we can still be doctors regardless.
Mm-hmm. Mm-hmm. Well, I think if you have a visible disability, it's the elephant in the room. You know, it's something you can't avoid talking about. And I think it's better to be the one to volunteer it and say, you're probably wondering why I'm in a wheelchair, or wondering how I might do this job being hearing impaired and having an interpreter. And in my past experiences, this hasn't been a problem. And if anything, it's only enhanced my abilities to do what I do with people. So I see it as the elephant in the room. I mean, having a hidden disability, it's not something you have to reveal, but a lot of times it carries with it a lot more pressure, because you have to feel like you hide it all the time and you can't share it with people and nobody sees it, and why should I tell them? But having a chair, having something visible, having a seeing eye dog, having an interpreter, whatever that might be, it's the elephant in the room. Be the first to volunteer and be the problem solver. And that shows you're proactive. And it oftentimes helps the people who are interviewing you go, oh, good, I'm glad that they brought that up, because that solves that. And you have some solutions for it. Mm-hmm.
Yeah, I just wanted to know if you had some tips for dealing with opportunities that you feel might be closed because you have obvious disability. I know in your experience you said when you were finishing school you felt like, you know, you had opportunities where people discriminated against you because you were a material. How did you first deal with those and kind of, you know, just keep on going?
Well, I had to remind myself that the world is a very large pond. And no matter what, we always want people to be the best they can be, and there's always going to be those that are not. And when I was being interviewed by a psychiatrist, and the psychiatrist was very insistent on knowing what was wrong with me, I was very nice in explaining that, you know, if you take me on for the internship, I'll be glad to sit down over a cappuccino and tell you exactly my history. But during the interview, I don't think it's appropriate. Well, I didn't get that placement. And then I told myself this: I don't want to work with somebody like that. I don't want somebody to be guiding me in my professional career that just doesn't get it. And then when I came to UC Davis, I was an intern. It was like a perfect fit. I mean, they got it. And I thought, thank goodness that guy came out of the woodwork and said what he said, and I didn't take it. There's something better for me out there, a better fit. So I think you do encounter these things. They do kind of get you down at times. And you go, it's another one of these little hassles I have to deal with. And people with disabilities have their own, I think, subset of hassles in life. You know, they say there's all these stressors out there, like not getting a job and doing these things, but we have our own little hassles. One of my hassles is finding curb cuts, you know, or finding an accessible bathroom that's nearby. I mean, those are my two goals in life, wherever I go. And then after I find everything, then I'm perfectly cool with it. So I think you are going to encounter people that are, you have to ask yourself, do I want to work with that person that badly? Or do I want to work someplace where I'm going to be appreciated for what I contribute and people get it? And I've been very lucky because I did find that, I feel. And again, it doesn't mean that everybody there is perfect. Everybody, you know, is who they are, but I think you know, them getting to know me and my work, all that, I think the disability kind of fades into the background. You remembered.
Yeah. So kind of along the same lines, I mean, I'm, you know, noticing some kind of overall themes. Like, for example, for myself, I'm still learning about, like, what exactly all of my differences are. Kind of like, you know, going as far as I can from one angle and then realizing, like, wait, okay, something's still not connecting. Okay, what if, you know. I noticed that because I went undiagnosed with a couple of major differences until I was already done with, like, K through 12 education, like, I just have huge gaps that I'm, like, filling in as I go. And I have, like, you know, for example, family members I think is a really common challenge for a lot of us, just in terms of really wanting to feel, like, encouraged and supported. And it's the extra time thing I'm noticing just comes up again and again, like, well, why is it taking you so long? Or if it's this hard for you now, then how hard will it be later when, you know, we may have only had maybe a couple of years of experience of actually even knowing even part of what's going on internally in a school setting. Are there maybe any suggestions or ideas related to just how we can kind of help someone to reframe things a little bit more accurately?
In family?
Yeah.
Well, yeah. This may I know. This may become a therapy session about family, but you know, my family were less than supportive because, you know, they were like, go get a job, get a secure job. Why did you leave the state? You had a secure job. How long is this going to take you? You know, 6 years, my gosh. And then you do with these internships. Aren't you employed yet? You're doing an unpaid one. And then when you're done with all that, they'll say, and you have to get licensed? How long is that going to take? So you get all these questions. And I found the best way to deal with family like that is to simplify it and not get into a lot of detail. And finally, when I was done, nobody said anything. It was like, they should be jumping for joy. They've been saying it for the last 6 years. And I tried to radiate towards people, other students, my friends who were supportive. I had some friends that were not, and I decided, well, you know what, I can't be around that right now. And I radiated towards mentors and teachers and supervisors and other people that were just as passionate as I was. And I limited what I told my family. Oh no, it's just gonna take a few more years. I said that every few years. And it did, finally. And then finally it was, they were acting like they were on my team the whole time. And I know they questioned me a lot, but it can be a lot of pressure. And there's no time frame in life. I mean, people go back to school at all ages. And if you tell yourself, I'm too old, or my God, I have some people say, I'm 28, I can't possibly do this. And I think, oh dear. You're never too old. I mean, life's out there to be lived. You can do what you want to do, your passion, and pursue it. It may take a little bit longer. But I look at it this way, it may be the best journey of your life too. It's never that straight line between A and B, as they say in math. It's the turns and the barriers and the things that stop you in your way, that make you think. You may take a detour on the road, and it's the perfect detour for you, and you find your niche. If I hadn't taken neuroanatomy, I wouldn't be here today as a neuropsychologist. I mean, to me, that just clicked for me. I just love dissecting brains. And I thought, wow, this is for me. So, finding your own niche in the medical field, in healthcare, it's the journey. So don't let age or disability or any of those factors stop your family, stop you. Your family, will be long gone in years to come, and you're going to be doing what you want to be doing. So.
I don't have any diagnosed disabilities, but I'm wondering about how can we work better together and to be better co-workers and mentors and students with disabled people? What are some suggestions that you have about working with disabled people?
That's a good question. People oftentimes will ask me, hey, can I give you a push? And they'll just ask me. These are my coworkers if we're going to a lecture up a hill or something. If it's a big hill, you better believe I'll take the push. Okay. Most of the time I'll tell them, no, I'm fine. I'll let you know if I need anything. And I think just, people, I let them know that just, ask me if you have a question. When I get to know people pretty well, that they might ask me, well, what happened? Or why do you use a chair? And I see you walk and you use a chair. And so they'll ask me. I think asking people is important, can I get that door for you? But you would do that with everybody anyway. It's being polite. It's what your mom and dad want you to be, is polite. And oftentimes when I'm putting my chair into my Subaru, I get especially little older men who like to come up and help me. And I think, well, that makes them feel good. And in the past, I didn't like anybody helping me, but it's more my issue of letting them help me occasionally, or opening the door and thinking, oh, I'm so appreciative of that. But I guess just being aware, and being people. I mean, if you're walking with somebody, I'll say to them, oh, let's walk down over there to the store, and I realize I'm rolling, and I'll say, we'll walk and roll. And, or people are afraid they're going to say something to offend me, and then we'll kind of make a joke out of it. But it's really kind of the relationship you have with people, and develop the sincerity with it, and asking them, if, hey, can I help you with that, or let me know if you need help.
Thank
you. I came in. I'm brain injured. I came in and my major question is disclose, not disclose, disclose, not disclose. I do very well in school, but I work very hard. If I have a professor that I know and trust, then I will tell them that I'm brain injured, and a lot of times they'll say, oh, this textbook will work in addition and help you out. So I worry about disclosing it because as soon as somebody hears you're brain injured, they think you're stupid, and I'm not. And then the other concern I have is you were referencing age. I'm 49 years old. So even if I didn't have a brain injury, I would be worried whether or not I can physically withstand a residency. So that makes me want to disclose, because if I disclose I'm brain injured, and that requires more rest, because otherwise I get into my issues. So I'm just not sure what to do or what's best to do. Is there any sort of guidelines or questions I could ask myself in making that decision as whether to disclose or not to disclose?
You know, I have those websites on here, and before people leave, if they want to get the handout, make sure you put your email on that list. Okay, you know. And I would go to those websites because there's a lot of people talking about the same issue. And some schools may be a lot more supportive, some residencies may be more supportive, and others may not.
Okay.
So,
So look for the internet gossip, as it were, from people in the same
it's
situation.
true. That's true. I mean, that's the network of information out there that is the pulse of what's going on. Yeah.
If you're engaging with someone and you're not physically with them, if you're over the phone or over the internet, are there any benchmark questions you have in your decision to disclose?
Who would you be communicating with?
Either a peer or a client? A peer for now. Because it's not really relevant.
Right. It might be relevant, like you said, to medical school or residencies if you need that extra rest and as an accommodation, or any kind of special learning assistance or extra time. Then it might be relevant for you for accommodations.
Thank you.
I just wanted to hear more about your work, your research, your interests. You mentioned traumatic brain injury. How did you come to it? I know you're a Ph.D, so I kind of just want to know what your project was and kind of where you are now, and kind of how you got from one place to the next, and what keeps you inspired. Yeah, and what drove your passion. You mentioned before it takes a lot of dedication, whether you're disabled or not. You know, life will throw things at you. I was just telling my friend, like, I don't think I have a disability now, but I could. And what would happen to me that would ever make me walk away from medicine? And she said, I couldn't think of anything. And I was like, you're right, I wouldn't be able to think of anything. But those curveballs do come at you. And in your experience, what helped you settle on traumatic brain injury and what kept you going throughout?
Well, I decided to go back to school in my 30s, and many years beyond that now, because I felt like I needed to be the super crip, number one. I needed to have a lot more under my belt. And when I was working for years, I didn't acquire a disability till I was in my 20s. So I was already established in my field of rehabilitation, and then I encountered discrimination, and to me it was the aha experience, like, wow, I didn't think this happened to people like me, never did before. And I realized I was now part of the minority. I had kind of been yanked over the line. I was in the non-popular group in high school. You never join that group. You don't want to be in the stigmatized group, but I was in it. And so I decided, I'm going to have to do whatever I need to do to have more options in life. And so that was one thing. And I went into neuropsychology because I just loved the idea of studying the brain and behavior. And it just made sense to me. It just made a lot of sense to me. And I'd been familiar with a lot of neurological disorders, and it just was a great blend of rehab, my background in counseling, and where I wanted to go. And my dissertation was on disability hassles, a term that I coined. So I needed to find out what kind of disability hassles or stressors that people with disabilities encounter on a daily basis. And way back when I did it, nobody was doing internet research. So I had to talk my school into letting me do that. So I designed a couple measures, and then I set up a website to gather my data, because I needed something like 250 responses, and I thought I'll never get out of school. So doing the internet research tended to be a real effective way of doing it. So I looked at the impact that disability hassles and disability identity has on person's psychological well-being. And also along the way I was testing out my measures on hassles and identity. So that I did. And I got very passionate about traumatic brain injury because we get a lot of people with brain injury. And I did some extra training. I was a brain injury specialist. And it can occur with people of any stage in life. And we get pediatric brain injury, adult brain injury. I do a lecture every year with law enforcement, teaching them about brain injury and how to interview people, how to deal with it in the field. So I also work with stroke. But traumatic brain injury is the one probably is my top, is my favorite. And sports concussions is another big area, and that's traumatic brain injury. So I'm getting the heads up from the cameraman. So if we had one last question, that'd be quick.
Being a medical professional, you're aware of the medical model definition of a disability. What are your thoughts?
Well, that is a challenge because I work both inpatient and outpatient. So inpatient, we have rehab therapists that are directing people in their care. And a lot of times they'll run to the psychologist and say, can't you help this person just learn to accept that they're paraplegic now? And I'll just say, look, we're just going to put out the little fires while we're here. When people go home, that's when they're going to really become a lot more aware of how it's impacted their life. And it's a process. I think when people acquire a disability, it is a process. They do rely on medical science for the cure, and medical science kind of relies on directing them and directing their care and then discharging them, and that's when life falls apart. So I think my approach when people come to me for therapy is to help them realize that there's a whole different dimension out there, being self-empowered and being aware that, it isn't a nice and kind world all the time. People can discriminate and there can be stigma. And a lot of times people by that time have experienced that. So I probably deal with the medical model by being anti-medical model in some ways. But I do have to go along with some of the evaluation part of it that we do. But I'm quite aware that people just don't get it initially. They're not going to. I can't shovel it down their throat and say, you're disabled now. Guess what? Welcome. And it's not going to really happen till later. So it is kind of a challenge. But I look at it this way. They're very lucky to have me there because I am kind of the maybe not a role model, but I'm a person that made it through. And it doesn't mean that everybody does. It doesn't mean that everybody makes it through, but there's that hope. And hope is really something we can all hang our hat on. So he probably ran out of film. So, well, thank you very much. They're going to get ready for the next person in this room, I think. And if you want to get a copy of the PowerPoint, then you can leave your email address on that sheet and I'll have somebody send it out.